Thank you, Mr. Chair. I just want to add to the comments and questions that my colleagues asked earlier this morning, and I really want to echo my colleague from the Assembly, Dr. Weber, and speaking to midwifery about how it's about safe mothers and safe and making sure that we have safe babies. I really want to emphasize that. I do have some concerns and some questions in this area. The first, I did a little bit of background and information gathering, and I have a number of 522 licensed midwives that were at least expected to report back in 2019. There is no report for 2020, but first I want to make sure that this number is more or less accurate. I also want to, kind of look at what the outcomes are per county. I know that in my little, digging through information, for example, in Marin County, there's 20 number of live births, and it seems that they had pretty good outcomes, at least to the report that was published in 2019. But I was wondering if we have more demographics of that into that report. And also what I also found a little bit alarming, I would say, is the information on the transfer of care of a patient or a client. Shortly before a VBAC, and I apologize, I'm not, an OBGYN or a doctor. I'm just trying to understand as much as possible, but there's about 21 clients that had developed hypertension during their pregnancy and had to be, their care had to be transferred. And there was a total of 253 clients in shortly before, delivery. There was also intrapartum transfer of care and issues like, prolonged rupture of membranes, and that had, numbers much higher there when it comes to some of the issues that occurred or came up. So I think that this I have some real concerns about establishing its own board, given that there could be complications, right? It could be prior to or during. I don't really know too much, but from my understanding is that there's real concern about the patient and the care, and there seems to be kind of two standards, perhaps not two standards of care, but there's two different practice acts that have to kind of, an OBGYN abides by one practice act, and then the midwifery abides by a different one. So, so if you could please comment or provide an answer on my statement, please.
I'm happy to comment on that, Senator Hurtado. Thank you very much for the question. The transfer of care, that tells us that midwives are acting appropriately, that if a condition arises that is beyond their scope, they are sending that person to the hospital. And that's important. As Dr. Weber said, things can change, and so you have a client that falls within a licensed midwife's scope of practice, and something changes during the course of the delivery, and so the midwife appropriately sends the person to the hospital, and that's exactly what they're required to do, what we expect them to do, and so the board doesn't consider that in and of itself a negative. Of course, questions arise if they acted within the standard of care on the timing of the transfer. Should it have been done sooner? Was this an appropriate client to take on to begin with, or to keep if a condition arose? But the fact that they're making transfers is exactly what we expect them to do if something changes and patient safety requires it.
And just as a follow-up, the Midwifery Practice Act authorizes a licensee to attend cases of normal pregnancy and childbirth. So how does, I mean, it kind of just seems to kind of contradict itself. If a pregnancy can have a complication, and many do, doesn't that kind of contradict the act in itself?
Well, it goes on to further define normal pregnancy as saying that there is an absence of both of the following: any pre-existing maternal disease or condition likely to affect the pregnancy. And that's that language that I referred to before as being a sticking point about what some of those terms mean, or a significant disease arising from the pregnancy. So, this is something where the legislature is going to have to help the board, ideally, respectfully requesting so, to work around this language to get clarity, because the board needs authority and clarity to go forward with the regulations on this. And those are concerns, and as well as what's expected of a physician working collaboratively with a midwife.
Okay, thank you. And my second question deals with international medical schools. So I know that prior to January 1, 2020, the medical board recognized about 2,056 international medical schools. From my understanding, there hasn't really been a reassessment of those schools that were recognized. I wanted to kind of get an understanding of what that time frame for recognizing, 2,000 schools, more or less. What was the time frame of giving them recognition, and what were some of the requirements that were taken into consideration or criteria for approval, and what would you say has been the outcome?
I'm happy to answer that as well. With the shift to the postgraduate training license requiring 3 years of postgraduate training, the board asked and the legislature changed how the board approves medical schools. And so now if a school is on the World Health Organization list, on FAMR list, it is recognized. The board no longer goes through a independent process to review and approve schools. Prior to that change, there were two different structures one for nonprofit schools, where the primary purpose was to educate citizens of that country to practice in that country. And the second one was for-profit schools, where the primary purpose was to educate individuals from outside of the country, for purposes of them going anywhere to practice. And so the for-profit schools required a much more intensive review to ensure that it met the requirements of the board. There's a lot of details went into that, which I'm happy to go over if you want to. It's just that is no longer the board's process.
I understand that. And when did this practice begin?
January 1st, 2020 was when there was a shift to postgraduate training licenses and no longer going through the approval process for schools.
But prior to that, when did, it seems like the international medical schools were recognized, or the program ended in 2020, but when did it begin?
Oh my gosh, way before any of our time here. The approval process for schools, I think, went back decades.
And how many of these schools are still recognized?
I can't speak to that right this moment, and we're happy to take a look at it, but I would suspect that all of them would be recognized with the current process because it's much more flexible for recognizing schools, and that's the point. It gives more people opportunity to qualify for licensure.
And when was the last time that the board did a reassessment? I'm sorry, not a reassessment. My apologies. So the other question that I have in regards to this is, prior to January 1, 2020, how many U.S. or Canadian schools applied for recognition? How many were approved and how many were denied?
U.S. or Canadian schools?
Yes.
Those the board approves if they're accredited by the LCME. So that's an accrediting agency that the board relies on.
So did we have a different process in place for approval prior to January 1, 2020?
For international medical schools, yes. But the process hasn't changed for U.S. or Canadian schools.
Okay. And can you speak a little bit more about the special programs? My understanding is that there's 4 that the medical board oversees that include the postgraduate medical school study by non-citizens, dean or chief medical officer of an AMC to sponsor an international physician, participation in fellowship program by non-citizens. I guess in regards to these 4 different special programs, how many have been, given out? And in your view, what have been the benefits of these special programs to California consumers?
I'm going to turn that over to Marina O'Connor, Chief of Licensing.
Hi, thank you. I'm just looking at the number just to see how many we currently have there. Just 1 minute. So in fiscal year 1920, we had 24 special faculty permits issued. So that's under Business and Professions Code 2168. Let me find the other.
And if not, that's okay. You can provide that information to me at a different time. I don't want to hold everyone up in committee.
Yeah, okay. I'll definitely get back to you with those numbers.
Okay, great, thank you. And I have just 2 quick questions. It should be the last ones. Now, my next question is in regards to the special faculty permits that have been submitted since the passage of AB 2273. How are we ensuring the quality of academic medical centers that sponsor individuals through the special faculty permit program?
So right now, we have there's specific criteria set out in statute for how an organization will, qualify as an academic medical center. So there's only one organization thus far that has expressed interest in identifying themselves as an academic medical center, and we're currently working with them on making sure they can provide the documentation to show that they meet those criteria in statute.
And the last question, it's my understanding that the medical board receives about $25 for licensing and renewals that go towards the Health Professions Education Fund that goes to the program, the Stephen M. Thompson Foundation Loan Repayment Program. It's the program that encourages new physicians to practice in low-income, underserved communities. Do you have more or less an estimate of how much money is raised out of those fees and how much is raised out of contributions or donations?
I don't have that in front of me, no, but we can definitely get that for you.
Okay. That is it. Thank you, Mr. Chair.